Hey, Jonathan here for EMS Office Hours. This is your Monday Minutes, and today we are on episode 19 of the EMS Quick Study Tips Resources here, and talking about anatomy and physiology. And of course, I would like to start off with explaining a little bit why this type of stuff is important. And of course, I always say it's important for exam prep because these Monday Minutes are geared to give you the key elements you need when it comes to passing and studying for your exam. But it's also important when you're thinking about what you're doing for your patient, how you're documenting it, how you're interacting with other healthcare professionals and explaining what's going on with the patient and what you think might be going on, and when you're deciding on your treatment and transport decisions based on what's happening with the patient. So it all kind of ties in together. So don't just take this as just some sort of exam prep. It's also much, much more than that. And when we talk about what we're talking about this week, we ended last week with the respiratory acid and bases and pH, and this week we're going to finish it up and talk about the metabolic pH. And again, this is a quick overview because I can't go into too deep into this content. I mean, this is sort of an hour long or so presentation all by itself. Like many of the Monday Minutes, it's broken down to 10 minutes or so based on a much bigger presentation. So keep that in mind, but I'm hoping that if there is something that you don't understand in this quick overview, that you'll go ahead and crack open that textbook, look a little bit deeper into what you don't understand, so that you do grasp it more, and that you can take home these key elements that I'm talking about in these short videos. So let's get into this, guys, and talk about metabolic acidosis. This is that too much of hydrogen, too much carbonic acid, low bicarbonate, and low pH. Okay, and I know this can be hard when you think about the low bicarbonate, low pH, high bicarb, low high pH, things like that. So there's no easy way that I can kind of give you to recall this off the top of your head. At the end of this, I think some of it might be able to bring some of it home for you when we start comparing metabolic and respiratory. At the end, I'm going to kind of wrap it up a little bit and hopefully maybe bring home some of the ways you can think about to differentiate when you see stuff on an exam about patients that have low bicarbonate or low pH and things like that, how you can sort of recall it on an exam. Okay, but when we talk about metabolic acidosis, let's get back to this real quick. Low bicarb and low pH, and the type of thing that you'll see your patient have with metabolic acidosis is starvation, the diabetic ketoacidosis that causes malbreathing, prolonged diarrhea, renal impairment, weakness, coma, disorientation, that orthomental status. And think about, of course, when you see patients like this, what are the causes and what are the treatments? And a lot of times, when it comes to the treatments, there's not a lot we do for these patients, right? A lot of it is supportive. It's IV fluid, it's airway maintenance and things like that. Okay, but it's also, but you want to be able to go ahead and figure out why it's happening, or at least you want to be able to figure out, okay, this is the type of thing that's happening with the patient, that there's some sort of acidosis going on, and what you can do to sort of mitigate it. Okay. Now we talk about metabolic alkalosis. This is that too little hydrogen, low carbonic acid, and your high bicarbonate, your high pH. Okay, and again, I know it's hard to kind of recall the highs and the lows, and I'm hoping that we can tie this in at the end and help you understand a little bit more. So this is the alkalosis, right? The high bicarb and the high pH. And what type of patients you're going to see with this? The signs and symptoms, things like prolonged vomiting, slow, shallow respirations, that extremity spasms, or that tetany, muscular tension, and again, mental has the mental dullness going on. And thinking about the causes and treatments, right? But at the same time, you want to also understand that this is, again, type of thing that we're not going to do too much for as far as medication, things like that, but a lot of it is supportive. It's maintaining the airway. It might be helping to ventilate the patient if their respirations are not adequate. It's about, maintaining that airway, okay, and perfusion for the patient. Now, what I want to do real quick before we wrap this up, I want to kind of get into a little bit about the versus, right? The acid versus alkalosis. When I talk about this, is that oftentimes, most of the time, what you're going to see, if a patient is let's say in respiratory acidosis here, right, with that low pH and high CO2, okay, it's going to be compensated by the metabolic alkalosis, or the higher an increase in the bicarbonate, right? So you're going to see a difference when the patient is acidotic due to respiratory issues, okay, like COPD, narcotics, sedatives, things like that. It's going to be trying to be compensated by the metabolic alkalosis. So you'll see stuff on the exam that'll ask you, okay, what's happening with the patient if they, let's say, have overdose. That they'll be, the pH will be low, but they're going to be respiratory acidosis, and metabolic alkalosis. It's going to give you the different breakdown, or it might ask, are they metabolic acidosis and respiratory alkalosis, and vice versa, okay, to try to get you to think about it. So when you see the two different things going on, okay, the patient normally will be opposite. Or that should at least give you a little bit of a head start when you're looking at the question and you think of what's happening. That if you see a patient that is respiratory acidosis, they're going to be the opposite. They'll be metabolic alkalosis. Okay, and you're going to see that in the next slide too when we talk about patients that have respiratory alkalosis going on, that hyperventilation, the anxiety call we get, which is common, but also the pain, or patient might be septic or have a pulmonary embolism, something like that. They're going to be getting compensated by metabolic acidosis, or decrease in the bicarbonate. Okay, so keep that in mind. It's going to be opposite when you see these on exams. Okay, so when you see questions asked about patients' high pH and that their respiratory alkalosis going on, or when I say high pH and what's the cause of the high pH? Are they hyperventilating, right? Or they might say the patient septic, and what would you expect their pH to be? Or they might be having an anxiety attack and they're hyperventilating. What type of respiratory issues going on, the respiratory alkalosis, acidosis, and what's happening in the metabolic end of it, right? So it's always going to be the opposite of the two, okay? It's going to be compensated by the other end of it, okay? So if they're respiratory alkalosis, it's going to be metabolic acidosis. And the same thing goes with the metabolic end of it. If they have metabolic acidosis going on, okay, things like the diabetic ketoacidosis and severe diarrhea, it's going to be getting compensated by respiratory alkalosis, or decrease in the CO2, okay. Or what we're talking about is that hyperventilation, all right, trying to help blow off those ketones, right. And then we talk about the metabolic alkalosis. That's when the patient is going to be compensated by respiratory acidosis, or a slower respiratory rate, okay, in order to increase that CO2. Okay, so the severe vomiting, the patient might be on diuretics, things like that. Now again, this can be confusing because you say acidosis and alkalosis long enough, you're going to start getting confused as to what's going on. So I think what might be good to do, if you're having a problem, is to go back in this video and in the last video and sort of try to remember what it is that's going on in each case, okay? And keep in mind, when you talk about respiratory, the body compensates much faster because it's trying to correct the pH imbalance by respiratory rate. When we talk about metabolic, it's trying to correct it via the kidneys, right? Trying to get rid of it through the kidneys. So it takes a little longer for the body to get rid of those acids and bases and whatnot, through the body when we talk about the metabolic end of it. But when we talk about respiratory stage, the body tries to correct it through the respiratory rate. Okay, so it's a little faster. Something else to think about when you're seeing scenarios and you're seeing questions being asked, what it is that's how the body's compensating for what's going on. Okay, so it should kind of lead you along the path that the ventilatory rate is what's trying to mitigate that pH. Okay, and again, guys, I know it can be confusing. I know that you can go back and forth with it, but I suggest to look at these these two videos, this video and the last video on the respiratory acidosis and respiratory alkalosis in the last video, and sort of try to put them together, see if you can grasp the key points that I'm trying to get across in these short videos. If you can't, okay, like I've said before, if you're having an issue remembering this stuff, okay, which I can see, especially when it comes to pH and acid and bases and stuff like that, it can be very confusing, right? So what I suggest you do is, if you're having an issue remembering these key points, go ahead, open up your textbook, and research and get the bigger picture of what's going on in your textbook, so that you can then turn around and grasp these key points, so that when you see them on exams and you see them in the field and you see your patients having this stuff going on in the field, it all comes together for you. Okay, a lot of people struggle with this year after year, and when it comes to test time, they have to really refresh their memory. I also have to do that. Okay, so this is the type of thing that you want to do by remembering these key points and refreshing your memory, or I'm hoping, if you don't remember it, that it motivates you to go online and research it, or if you're a member of Paramedic, to use one of the resources of Paramedic to research it, or to open up your textbook and look inside your textbook and research it there as well, so you can have a better and deeper understanding about what's going on, so that when you see it on an exam, you're not struggling as much. These questions and these quick study tips are designed so that when you see these types of questions on an exam, you don't struggle as much. That these are questions that you get right off the bat. You're not giving away points on an exam that you don't need to give away. Okay, so you're struggling enough with scenarios and everything else. Don't give away points on the exam for basic knowledge type stuff like this. Okay, so I'm gonna wrap it up here, guys. And next time we're going to actually wrap up the entire anatomy and physiology part of these Monday Minutes. We're going to end it with the urinary and reproductive systems, and that'll wrap up that, and we'll get more into some more study tips, but we're going to get into more of the treatment and things like that of specific issues that go on with your patients out in the field. So we're getting, really getting into this content. I hope you're enjoying it. If you do have any minutes of your own, or suggestions, be sure to send them over to me. I'd love to hear them as well. And when we talk about some of the key elements and talk about studying for key elements, I do suggest that you take a look at the EMS Quick Study Guide on the site. And this guide is what really motivates and sort of designed these Monday Minutes to kind of bring home the key content and the elements you need to pass an exam. And this is something that I use before an exam. It really does help me kind of pinpoint areas that I need to go ahead and refresh on. Okay, even myself, that I'm exposed to this content quite frequently, there's still things that you forget, or that you sort of second guess yourself on. So if I don't see it, if I look at the guide and it doesn't click for me, then I go and open up my textbook, or I use something like Paramedic, or I use something like the internet to go ahead and research this information, so that I can go ahead and be more confident on that content. Okay, so this is a great resource to use, guys. You can use it throughout your EMS career. I highly suggest you go check it out and see if it might be something you might want to add to your EMS library. It really does break down that big, thick textbook into about 110 pages or so. Okay, all right, guys, that's it for me. Again, if you have any questions, comments, concerns about these Monday Minutes, please send them to me at contact@emsofficehours.com. And remember, guys, this is just scratching the surface of what it is to be an EMS professional. And again, if there's stuff here that doesn't come home for you, doesn't click for you, I can only do so much in these short videos. But I'm hoping that at the minimum, if it doesn't ring true for you, or you're struggling with it, that you'll go ahead and research it and get the answers you need, so that you do become more of a master of this type of content. Okay. Of course, you can always email me and we can discuss it together via email as well. I'd love to do that also, so be sure to consider that too. All right, guys, that's it for me again. Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.